Hello and welcome to our presentation. Today we will talk about hormone replacement therapy. First we will talk about the definition. Next we will talk about the function of hormone, estrogen and progesterone. And last but not least we will talk about the treatment involved in this HRT. First, what is hormone replacement therapy? It is a treatment to relieve symptoms of menopause. It will replace the female hormone, which are lower level as they approaching the menopause. Falling level of those hormones can cause range of physical and emotional symptoms. Reduction in estrogen can cause symptoms associated with the menopause, which include the hot flashes, night sweats, vaginal dryness, loss of libido, and bone thinning. Bone thinning, which can lead also to osteoporosis and fractures. The main goal of hormone replacement therapy is to replace back the female hormone levels which are depleted during the menopause, thus relieve the symptoms and improving their quality of life. A synthetic form of progesterone called progestogen is usually used in combination with estrogen in hormone replacement therapy. Who cannot use hormone replacement therapy? Hormone replacement therapy may not suitable if you are pregnant, if you are having a history of breast cancer, ovarian cancer, or womb cancer. Next, who cannot use HRT? If you have history of problem in blood clotting, if you have a history of heart disease or stroke, or you have untreated high blood pressure.
I will explain about calcium regulating drug. There is one drug under calcium regulating drug, which is the radixifen hydrochloride. So it is indicated for the treatment and prevention of postmenopausal osteoporosis. The dose is per oral, 60 mg once daily. For the mechanism of action for radixifen hydrochloride, it is a selective estrogen receptor modulator that has selective agonist and antagonist activity on the estrogen receptor. For the adverse drug reaction, there will have hot flashes, flu-like syndrome, leg cramps, peripheral edema, sweating, and arthralgia. Rarely, there will have GI disturbance, rashes, thrombocytopenia, increase in blood pressure, headache, including migraine, and mild breast symptoms such as tenderness and pain enlargement. Next is the drug interaction. It will reduce the absorption of enterohepatic recycling with cholestyramine, and it may also reduce the efficacy of warfarin.
The next treatment that is available for HRT is estrogens. So, estrogens come in different types of dosage, which are oral dosage, topical gel, transdermal patches, and implanted estrogens. Study has shown that lower doses of estrogen are effective in controlling postmenopausal symptoms and reducing bone loss. For the oral estrogen, the first example is conjugated estrogen, which is equine. So the indication for the conjugated estrogen is menopausal symptoms. The next one is for the topical gel. So the topical gel is called estrogen and is for menopausal symptoms. It applies 1.25 gram per day once daily, and it applies at from wrist to shoulder. So implanted estrogen is the estrogen that implanted subcutaneously at the abdomen or buttocks, and they are difficult to remove. The next type of dosage is transdermal estrogen patches. So the example for transdermal estrogen patches is 70 beta estradiol, which is estradiol. Okay, so we are going to the third classes under HRT, which is progestogen. So under progestogen, we have norepinephrine,
also progesterone. Okay, so I'm going to explain about norepinephrine first. So the indication of norepinephrine, it can, other than treating postmenopausal syndrome, it can also be used in endometriosis, menorrhagia, dysmenorrhea, and to delay menstruation and also contraception. The contraception, it is advisable to take 350 microgram daily. So the next medication under progesterone is progesterone. So the indication of progesterone, it can be used to treat infertility due to inadequate luteal phase and also to treat premenstrual syndrome or postnatal depression. Contraindication of these classes. So patient with history of liver tumor, breast cancer and genital cancer cannot use progesterone because it has patient will have high risk to get cancer. For the side effect, these classes can cause acne, alopecia, anaphylactic reaction, breast tenderness, and also hypertension.
Okay, next classification of drug is combination of estrogen with progesterone. Under this classification, have three combination of drugs which are estradiol and dydrogesterone. The second one is norgestrel and estradiol valerate, and the third one is estradiol hemhydrate and drospirenone. These three combination of drugs have the same indication, which is for estrogen deficiency and prevention of postmenopausal osteoporosis in women that have lasted menopause more than 12 months. For the first combination of drug, which is estradiol 1 mg and dydrogesterone 5 mg, the dose is 1 tablet per day and they have to be taken continuously without a break between packs, and they can be taken with or without food. Secondly, for norgestrel 500 mcg and estradiol valerate 2 mg, which is under brand name Progluton, the dose, they have two types, which are white and brown. For the third combination of drug, which is estradiol hemihydrate 1 mg and drospirenone 2 mg, the dose is 1 tablet daily continuously. All these drugs have common side effects such as headache, nausea, and weight gain. And they also have adverse effects such as dysmenorrhea, premenstrual-like syndrome, vagina candidiasis, and also breast enlargement.
So for the last drug is the anti-estrogen, which is clomiphene citrate. So for the indication, it used to the treatment of female infertility due to oligomenorrhea or secondary amenorrhea. The mechanism of action is clomiphene is a non-steroidal compound that has both estrogenic and anti-estrogenic effects. It stimulates the ovulation by inhibiting the negative feedback effect of estrogen at receptor sites in the hypothalamus and the pituitary. It's used to induce gonadotropin released by occupying estrogen receptor in the hypothalamus. It used to interfere the feedback mechanism, which is the cryonic gonadotropin, which is used as an adjunct. For the contraindication, it is used for abnormal uterine bleeding of undetermined cause, for hormone-dependent tumors and ovarian cysts.
Two types of algorithm that being used to determine when you are going to initiate the HRT therapy in postmenopausal women. Okay, if say there is no such symptom, we will not recommend any HRT, and we just advise patients to get healthy lifestyle and of course reassess for every year. For patient with symptom of menopause, and let's say the patient has contraindication to HRT, we will try to try alternate approach and reassess every year. And if let's say the patient has no contraindication to HT, we look into her history. Either he has done hysterectomy or not. And let's say if the patient had done hysterectomy, we look into the menopause status. Either it is earlier or late. If let's say it is earlier, we will recommend to do estrogen progesterone therapy. This is combination, also known as HRT. And let's say if it is late stage, we do not recommend to start EPT, but we will try alternative approach and reassess every year. Okay, for the algorithm, that based on risk of osteoporosis, for patient that has high risk but contraindicated to HT, we will recommend, we will consider for bisphosphonate, raloxifene, or alternative approach, and of course reassess every year. Meanwhile, for patient that has low risk of osteoporosis, no need for HT, and but we still recommend to do reassessment for every year.